I know a lot of people are still living under the shadow of COVID-19, and they can't wait to get their normal lives back. As someone who witnessed the outbreak in Wuhan firsthand, I think sharing the experiences from the former epicenter will help other regions that are seeking a solution. So here I'd like to talk about how Wuhan, a city with 10 million residents, tested, monitored, and contained COVID-19. First, testing. In the early stage of the outbreak, it took 2 days to get the result, but that time was soon shortened to 4 to 6 hours. And that further helped in testing more people. In the very early stage of the outbreak, Wuhan could only test 300 people a day. But that scale was soon hiked to 50,000 people a day in mid-April. Well, testing is without a doubt a crucial step to find all kinds of patients. But how to make sure whether they are showing similar symptoms, whether they are asymptomatic? How to make sure they can get proper treatment? Well, here comes the power of communities. In February, on community level, Wuhan carried out a citywide screening. Community workers went door to door to check health status of each family. During these checks, they were looking for 4 kinds of patients: confirmed patients, suspected patients, patients with a fever, and people who had been in close contact with such patients. Each of them received proper treatment that suited their specific conditions. For example, confirmed patients were sent to hospitals. Mild and ill patients were sent to makeshift hospitals. Patients with a fever and close contacts were sent to quarantine centers for observation. But of course, at first there were people who refused to go to hospitals or quarantine centers. For example, this patient we met in Wuhan was initially refused to cooperate.
我是阴性放阴，要是把我弄起来，我立死的。
你不想去是吗？
肯定不想去的。对，你也是。是往松了，你想不想？说我在想在屋里头说几好嘞？
他肯定是有，肯定片子上有问题。
他认为自己没问题了，那怎么可能自己说了没问题就没问题了？你要用科学的手段说你没问题了就没问题了。
我觉得这还是有一点，
就是靠这个
一定要排查到每一个人，是为了你好我好，整个国家都。
我已经干14天了，还要不要？
再坚持3天，好吧，3天给你复查。
After being taken for examination, it turned out he was indeed infected. By doing so, authorities made sure that no one who was infected or potentially infected stayed at home and passed on the disease to their family members. Communities not only played a crucial role in finding patients, but also helping each household get their groceries delivered and dealing with emergency situation, ensuring people can live a comfortable life without leaving their apartments. I know lots of people had doubts over the necessity of the lockdown in Wuhan. When it was first put in place, lots of people said it was a violation of human rights and people's liberty, but it was necessary. The lockdown was put in place just 2 days before the Chinese New Year, when the largest human migration takes place. So the lockdown stopped the virus from spreading further to the rest of China and the world. Also, the strict lockdown snapped the transmission chain. Effective or not, the speedy recovery of Wuhan is the best testimony. Oh, by the way, the latest good news from Wuhan. In order to put everyone back to work and school safely, Wuhan finished a citywide testing on June the 1st. They checked each one of the 10 million residents within 2 weeks. The results? No new confirmed patients, 300 asymptomatic patients. Wuhan is back with a bang.